right, let's get some more insight from Angela Clendenin, who's an epidemiologist at A&M School of Public Health in Texas. Thank you so much for joining us on the program. Now, first off, just tell us if it's common to see new strains of a virus like COVID-19.
Absolutely. Viruses really basically consist of some sort of a capsid that has basic genetic material, RNA, inside of it. And when it invades the cells in our body, it commands itself to replicate over and over and over again. And every time it replicates, a virus replicates, it introduces errors into that genetic code, little genetic changes. And that can eventually lead to a new strain. And you can think about it, it's very common, like the flu. Influenza is notorious for mutating. Every year when we try to prepare a vaccine for that season's flu, we have to kind of understand the strains that are circulating at the time. And sometimes we have to create vaccines that treat 3 or 4 strains, the trivalent or quadrivalent vaccinations, to protect ourselves every flu season. So the fact that SARS-CoV-2 has mutated is not unusual.
So is there any chance that the mRNA vaccines that were created by Pfizer and BioNTech could work to combat this new strain of the virus?
Well, from what they're seeing in the early indicators of the vaccine is that the mutated virus is not any more defensible against the antibodies that are building up in our bodies if you've been exposed to SARS-CoV-2. So it's hopeful that the antibody response that the vaccines prompt in our bodies will be effective against any particular strain of COVID.
All right, Angela Clendenin, thank you so much for joining us on the program and sharing that insight with us.